everyone. Thank you for tuning in to Health Corner today. This is a health show that gives you the proper health advice in a simple language and answers many of your questions regarding your health. Today we're going to discuss depression. Depression can affect adults, children, but today the main focus of our discussion will be depression in adults. At another show, we're going to do depression in children and possibly depression in women who has just had a baby, called postnatal depression. These are different types of depression. Now, depression in adults, I'm sure we talk about depression on a daily basis. Now, but simply defined as feeling low mood, feeling down, sad or hopeless continuously for a period of 2 weeks. You can also say somebody who is depressed will tell you that he has no interest or little interest or pleasure in doing things. These are cardinal signs of depression. So, in other words, depression is a state of the mind where the mind is low, downcast, hopeless. You don't have any interest in doing anything, and that leaves the person sad on a daily basis. And for someone who has had this condition for more than 2 weeks, it is said that the person is depressed. Depression can affect anyone. In fact, it's been found out that at any given time, 20% of adult population are suffering from depression. Now, depression is something we should be open about, to talk about, especially if people living in the UK, the black and ethnic minority groups. So there is nothing, there's no shame about talking about depression. You should not be ashamed. I know the society tries to stigmatize people who have depression, but that is not the case, because you find out that by speaking out, you are actually helping to treat yourself. And we've been given the gift, to treat depression by ourselves. But if you can't do it, there are professionals who can sit down with you and, bring the solution from within yourself. So this is the first step. Now, how do we know we are depressed? I would like to use this show to tell everyone about what we call the Patient Health Questionnaire. It's called PHQ-9. This is a questionnaire that contains 9 cardinal questions of depression, and it gives a score to any of the answers you give. At the end of the day, you can actually find out what you score, whether you are depressed or not. Now, the PHQ-9 has 2 cardinal questions. Remember how I define depression. It's a state of having little energy or pleasure in doing things, or feeling down, depressed, or hopeless. Now, there are other questions which we will ask to help us find out if you're actually depressed. And if you're depressed, what is the severity of the depression? Now, if you go to your doctor, and tell him about your mood, that you're feeling low, one of the things the doctor will do is to use this PHQ-9 questionnaire to find out how depressed you are, because treatment depends on the severity. Now, the next question the doctor might ask you, after finding out if you have little interest or pleasure in doing things or feeling depressed and hopeless over 2 weeks, the next thing is, on the questionnaire, is whether you have problems falling asleep. I mean, if some people they're just rolling in the bed, they can't sleep, it could be a sign of depression. Some people might actually be sleeping too much. So depression does not have a particular state of mind on whether you sleep well or you don't sleep well. You can sleep well and you'll be depressed, or you can you can have no sleep and you're still depressed. Now, the next one is, are you feeling tired all the time? So tiredness, having little energy, these are signs of depression. Remember, there are other causes of having little energy. Now, the other one is your appetite. Are you eating well, or are you overeating? Some people overeat when they are depressed. I can tell you, along the show, I'll bring in specialists to talk about contraceptives in women. And one of the medications actually make one of the side effects of one of the medication is to cause mood swings, and the mood swings is more of depression. And you find out that these people, when they have mood swings, feeling low on those tablets, start eating too much, and then they add weight, and they think it is actually the pill, but it's actually because of their mood. So the next question on the questionnaire, which which the doctor will ask you is, do you feel you've let your family or yourself down? Because these are some of the key subtle signs of depression. You wake up in the morning, you just feel hopeless, you feel you've let yourself or your family down. And then the other one is your concentration. How is your concentration level? Are you concentrating very well, or do you forget things when at the slightest opportunity, you just get something, you forget where you kept it and you'll be looking for it. But some people have real problem with concentration. They cannot concentrate to do anything or complete any task. This could be the sign of depression. Now, for some people who are depressed, they might be walking about or pacing around or speaking so slowly they will annoy people. You can find out that their speech has changed. This is also a cardinal sign of depression. Now, the last one, obviously, one of the things the doctor must ask you about is if you feel like hurting yourself in some way. I mean, people who are depressed might take overdose of medications. They might go, committing suicide. So suicidal ideation. Do you have plans of harming yourself, or any plans? So these are the things the doctor will establish, and these are all contained in this questionnaire. This questionnaire can be found online, so you can actually do the assessment at home yourself. It's called PHQ-9. So these are the things, the subtle signs that tells you whether you are depressed or not. And if you are, you can use that to score the severity of the depression. So when you go to the PHQ-9 questionnaire, it has points. Each of the questions is given a point from 0 to 3. So if you say you are not at all to any of the 9 questions, is 0. If you have the symptoms several days, is 1. More than half the days is 2, or nearly every day is 3. So if you put the score against each of the questions and then you total it, that will now show you how depressed the severity of the depression. So 0 to 4 on that scale is no depression at all. That means if you score between 0 and 4, you're not depressed. 5 to 9 is mild depression. 10 to 14 is moderate depression. Then if you score 15 to 19 is moderately severe. Over 19 to 27 means that you're severely depressed. And once anyone enters into the moderate level, he needs professional advice. So depression, in other words, can be classified as mild, moderate, moderately severe, and severe. Now, there's another type of depression which people do not know or do not know much about. This is called subthreshold depression or dysthymia. This show is very important because it brings some of the things we don't know, or you might not even find out from your doctors. People can be depressed, but they feel happy, they will be smiling to you, but they're actually not well. So we found out that if someone has a low mood for 2 years or more, you might not tick all the boxes of depression, but subthreshold depression is in the moderate to moderately severe range of depression. Those people can cope, but inside them they know that they're not happy, they are depressed, and they could be like this for more than 2 years. So for that, you really need professional help, because the treatment for that is completely different, and it takes a bit longer. So this is all about depression, the things we know about depression. We see this every day. Some people you see, they smile to you, but that does not necessarily mean they're happy. So depression is a problem, we see every day, we actually experience in the course of our life. But, recognizing this and doing something about it will help our mental health. So I will be back after the break, to talk about what to do about depression.
Health Corner on BENTV by Crystal Life. is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome back. We're talking about depression today. The first part of this show, I talked about what depression is, how do we know we're depressed, how do we measure the severity of the depression, what are the cardinal signs and symptoms of depression. Now, in this part of the program, I'm going to talk about what do we do about depression. How is it that we can help each other? If when you go to your doctor, what are the things you talk about with him regarding depression? Because sometimes if you don't give your doctor the right information, he will not help you. So, I've summarized depression in the first part. I said it's a condition, it's a mental health problem which is very common. Almost up to 1/3 of the adult population, might be depressed at some time. And people are depressed as a reaction to certain things in life. I mean, if you have a problem, whether it's a disease or a family condition or a stressful condition for long, you might be coping, and at some point your coping mechanism might fail you, and then you start, feeling the symptoms of depression. So there's something I normally tell everyone, all my patients. I said, watch out and talk out about depression. There's no stigma. It is a treatable condition. It affects anyone, whether, no matter where you come from the world. It's very common among ethnic and ethnic groups, the minority ethnic groups in the UK. But remember, some people you see, they don't like to socialize, they're lonely, they're sad, sometimes they're withdrawn. You'll be wondering what is going on, what type of person is this? It has nothing to do with culture or religion or ethnic background. I mean, it cuts across all those factors. So depression can happen to anyone. And then, people hide depression because of the fear of stigmatization. People in the family try to be dismissive, when it comes to mental health problems. But that is not the solution, because the more you speak out, the more you seek help, the more people that get treated. So individuals are always encouraged. I encourage individuals to speak out because it's treatable. I encourage families, to seek help, to support the individual, because just merely talking about depression is actually a form of therapy. So you find out that people who are depressed, once they're able to communicate and talk about it, they are actually treating themselves. And this is the basis of psychological treatment. When you talk about psychotherapy, going to psychologists, the psychologist sits you down and help you to talk about those things that makes you depressed, and then actually help you to find the solution from within, because you have the gift to actually come up with solutions, to overcome the factors causing depression. So always talk about depression. Don't keep it to yourself, because it makes things worse. Now, I'm going to talk about what we do about depression. How do we treat depression? Remember, we talked about mild, moderate, moderately severe, and then the severe and complex one. Now, if one has a mild depression, you might find out that, you do not need to see someone, to treat it, because many people with depression actually get over it. They find out, I was depressed last year, but I got over it by myself. It could be with time, it could be by talking about it, or it could be removal of the things causing making the person depressed. So if one has mild depression, you might do some lifestyle changes. Look at the things. Look at ask yourself, what are the things that are making me depressed? Causing this depression. And you might find out that the solution can actually be proffered by you without having to seek help. But as a general rule, if you suspect you're depressed, always seek help. Speak to someone about it, because you might think you have mild depression, but actually you have moderate or severe, and you need help. So we always advise people to see your doctor, go to your family doctor and talk about depression, whether it's mild, moderate, or severe. Always seek help. So there are things your doctor might ask you to do. There are you can actually go online and do what we call computerized cognitive behavioral therapy. It's a very simple thing. There are websites in the UK and elsewhere where you can read how to support yourself through the stage of depression. Now, this is for mild depression. Now, the next level of depression is when someone has mild to moderate depression. I'm now taking you through what we call a stepped care model. This is a model developed by the National Institute of Clinical Excellence, UK. It's stepped care because depends on which part of the step you are, the treatment varies. So the lowest part of that step, the downside of the lowest, I'll call it the lowest step, is the mild depression. Now the next step is mild to moderate depression, and this is where dysthymia, which is depression for more than 2 years, comes in. The treatment for that, you really need to seek help. It's computerized. You can use the computerized CBT. CBT, I said before, is cognitive behavioral therapy, which is what the psychologists use. There's the low intensity CBT, where the psychologists sit you down, talk through things, and tell you how to overcome this depression using certain tools. But for this one, you really need a professional, to talk to you about it. So, for mild to moderate depression or dysthymia, you need psychological help. But in that psychological help, you might be taken through the low intensity cognitive behavioral therapy. Now, always refer yourself. If you think you fall into the mild to moderate depression, always speak to your family physician, who will guide you on what next to do. If you can't get a family physician, speak to a psychologist or a counselor. These people are trained to support you. Now, the next step on this stepped care model ladder is the moderate to severe depression. Then there's some dysthymia that belongs to this group. For this, you will definitely need a specialist attention, a psychologist, a doctor. It could be a family physician or a psychiatrist. These people, professionals, will assess you and find out what medications you might need to take if that becomes necessary. And you might take the medication and join it with high intensity cognitive behavioral therapy, CBT. So for moderate to severe, you need support. You need to see a professional. I'm going to talk about antidepressants a bit later, but let me finish the stepped care model. Now, the highest step on the stepped care model is the severe depression. For this, there is no doubt you must see a specialist, and that is mainly a psychiatrist. Some people who have severe depression might have what we call severe complex depression, which will need hospital admission. So please, depression is a treatable condition, and people have killed themselves because they did not seek help. And this is the reason why I'm giving you this information. There is no depression, there is no level of depression that is not treatable, but you just need to seek help, and seek help at the right time. Now, coming to medications, I mentioned medications. There are so many different antidepressants. I can tell you that antidepressants are used, commonly everywhere. They are not addictive. If you are prescribed antidepressants and it's helping, please, if that is your first time of taking it, most companies that produce antidepressants will advise that you be on them for at least 6 months after feeling well on them, and then you gradually come off them. And once you come off them, you don't need them anymore, because obviously you are well and you don't, they are not addictive. So there are different forms of antidepressants. Sometimes you try one antidepressant, it doesn't work. Your doctor might switch you to a different one, and there are so many different ones in the market. So depending on the level of depression, you might need just ordinary psychological support, but you might need medication, which is antidepressant. And coming to psychological support, the psychologists know how to grade the low intensity, the high intensity CBTs, and some other treatments. Obviously, I'm not going to talk about the hospital one because these belong to the specialists, the psychiatrists, where they use electroconvulsive therapy. But for those people, they are really very ill, and it's not something you can manage, treat at home at all. Please, I will also inform that some people believe that herbal therapies, there are herbal therapies for depression. Yes, but I cannot give you a clear advice on any herbal therapy that has not been tested. I can only tell you what has been tested. So, we know that some herbal therapies do work. They work on low depression. Please, if you have the moderate or severe depression, please do not treat yourself. Go to a specialist. And these specialists are very well trained to support you. So depression is common in our society. It is a treatable condition. If you need medications, they are not addictive. You can take them and feel well and stop them once you are well under a psychological or a medical supervision. We've covered depression in adults. Now, I'm sure some people might have questions to ask. Look at the details on the screen. I've got there are telephone numbers to send me a text or email. I will answer your questions. So feel free to contact me on these numbers you see on the screen, and I'll be happy to respond. Thank you.